First of all, thank you so much for listening to me a little bit about the project. I will talk about the project XpanDH, enhancing the European electronic health record exchange format adoption on the European health data space. It's very nice. This speech comes after a little bit more explanation about the European health data space that is very interesting at this point. So the first point is basically to ask to you about what is the European Electronic Health Record Exchange format? What is the format that we're talking about? So this question don't have like a final meaning, but like as you can see in the presentation, we have different kinds of the formats. Each one of the formats can also be represented one of the use cases that you have currently, like the patient summary, prescription, and other ones. All these formats can be represented, can represent the patient summary. However, depending on the format that you choose in this point, we have a different level of details that you can apply on this kind of format. And also, not all those formats have a same level of the interoperability. So depending on the kind of the format that you choose here, they don't have too much interoperability, and you need to change a little bit about what you intend. So keeping on the idea about some European electronic health record exchange formats, we needed to think also in some circumstances that can strange this format. The first of all should be this format should be publicly available, so it's a means to be a collaborative point, so all the member states and vendors could have access to this format and also do the developments regarding this point. Also, this format, one of the premises of this format should be the co-creation development that you are pushing also inside of the XpanDH. So if you have a co-creation process, you can consult the different stakeholders in the e-health community in order to give some of the vision about the format that should be interesting in order to attend the final users, the policymakers, and other points. And also, this format should be also implementable, because don't need to have idealized perfect kind of the format to exchange health data, and this format is not be implementable on the reality. So we needed to consider these points also. Inside of this format, we need to consider also some elements that you will be choosing depending of the service and depending of the perspective that you would like to have to implement this point. So the idea of the format, they can have different kind of categories, and all these formats can be represented inside of the electronic health record exchange format, and depending of the kind of the services, the patient summary, prescription, discharge report, all those kind of elements could be supported, but depending of the service, we have a different one implemented. So in resume, like the European electronic health record exchange format is a format to be represented different health elements inside of electronic health records, and also be able to be a more interoperable format among the European countries, health systems, and other points. In that sense, I would like to talk about a little bit of XpanDH, that is expanding digital health through a pan-European electronic health record exchange-based ecosystem. So the idea of this project is to create a European network of networks in different stakeholders in order to support the development, implementation, and also experimentation of the electronic health record exchange formats in different ways. So the project also is aligned with some of the regulations that have been released by the European Commission in the past years. So if you take in consideration, we have here since 2019 the release of the recommendation about the electronic health record exchange format, and later on, inside of the European health data space proposal, they have specified some requirements from the European health record exchange format. So together with the different stakeholders, member states, the health network, policy officers, and also My Health at You, they are also converting a lot of effort in order to have a common format, electronic health record exchange format for the European. So XpanDH is aware about this movement, and also is supporting this implementation and other points. As you have seen before a little bit in the presentation regarding the European Health Data Space, in this regulation there is some specifications about the requirements and also other details that are very important to consider on the formats. But inside of the European Health Record Exchange format, they follow basically many of the European rules, international codes, in order to have a more interoperable and international format as possible. And also in alignment with the text, the current text of the European Health Data Space, that you can also be accessed by internet. If you put the European Health Data Space, you can find the full proposal of regulation. So, in line with this recommendation, European Health Data Space recommendation, the project also is considering the datasets, defining structures, code system, and also technical specifications that will ensure that all the developments inside of this format will be compliant with the regulation and also with the current European legislation in place. If you see the flux of information and developments about the project, we have here basically the beginning of our journey of the Europe XpanDH project is basically the definition about the adoptions domains, that is instantiation of a use case with more details and also all information that is required for the implementation. With the definition about the adoption domains that we are working and also experimenting inside of the project, we are together with the 3 work packages doing the first cluster, the developments about the X bundles. X bundles is what we call inside of the project the collection of assets, requirements, and technical requirements, and other ones that are required to implement the project and required to implement all these use cases that you are talking about. With this point, we have development of the readiness model. That is a model to be further implemented and developed regarding this format. So the results about the X bundles and readiness model are being tested inside of the project in some experimentation bubbles that are working on in 2 different domains that are laboratory results and also discharge reports. With this report, with these results inside of the experimentation and also development about the formats, 2 work packages, 5 and 6, they are working on together with the expanding of the ecosystem of the European Electronic Health Record Exchange format, and also development a network of networks in order to engage different stakeholders in different hubs. This network of networks is called XNets inside of the project, and it means to put together vendors, industry, patients, healthcare professionals, and other professionals that can also support in the developments and direct some points regarding the project. So just to exemplify, I would like to show to you the bubbles that you are working currently. So we're working 2 domains of the Electronic Health Record Exchange format. That's basically laboratory results and also discharge reports. And inside of each one of these bubbles is basically some of the partners of the project that they are willing to implement the service and also development of the format in different small use cases. In this case, if you think about the Portugal, that has 2 bubbles, is basically to organization to patients through the health app to be access to the health data regarding discharge reports or in the laboratory results. And each one of the countries is also on the partners. They have the same point of view to develop and experiment one of the developments about the format. So it's not hard to develop the format, the European format, because we are following the international rules and also the recommendations of the European Health Data Space that you have in place. And this is very important in order to have the final results of the project and also prove that's feasible to develop and implement different developments about the European Health Record Exchange format in this. So I would like to thank you so much for the presentation. I think my time is gone. And for last, I would like to just send to you the QR code you can scan for all the social media of the project with some more information about it, and also my email is that. So thank you so much.